So I'm one of the clinical dietitians from Beaumont Hospital. Been there for the Royal Oak campus. Been there 18 years. My primary focus for the last 12 years has been on oncology nutrition. So a little bit of background. Most of you probably know most of the information, but there's a number of new cases that the National Cancer Institute reported in 2013, and majority of the patients are over 65 when they are diagnosed. Now the cause is unknown. They're not certain if it's, there's multifactorial things that could be contributing to the prostate cancer, but the highest rate of occurrence is in the African American population. So age, race, family history, and diet are contributing factors, and some of the other factors are obesity, infection, vasectomy, the insulin-like growth-like factor, high levels of that. Now tonight I will be discussing ways that we'll address obesity, the reduction of the insulin-like growth-like factor, and chronic inflammation. So obesity is the largest contributing factor. It will actually decrease the risk of non-aggressive tumors, but will increase the risk of aggressive tumors, and that's what you really, the one that needs to be addressed the most. So we'll look at the elevated BMI, and the risk of recurrence when you're looking at a normal weight decreases. For obese patients, it's an increase of 30%, and for the very obese, it's 69% increased rate. With that being said, I do caution on the BMI. It does not take into account musculature structure. So what we would recommend, and a little bit more accurate, might be faster too, is to go with waist circumference. And that would be where you would take between the end of your ribs and the top of your hip bone. And that would give you your waist circumference. And it's a pretty simple way to look at where the majority of the fat tissue is being deposited. So when we're looking at just BMI, we're looking at just height, weight. We really want to know about the fat tissue. So if we're looking at, and not only will the waist circumference give you an idea of whether or not you'll have higher mortality rate from prostate cancer, but it will also indicate cardiovascular events too, future of that. Most of what I will recommend tonight will not only help prevent recurrence of prostate cancer, but will also help to prevent many chronic diseases, cardiovascular disease, diabetes, Alzheimer's, and a lot of stroke, things like that. So we'll go over all of that. But so the waist circumference, if your waist is 35 inches or under, you're normal. 35 to 39 overweight, and over 40 would be considered obese. And they have found that as much as a 2.2 kilogram increase in weight after having a prostate removed puts you at greater risk, doubles your risk of recurrence, and that's just merely a 5-pound weight gain. So we really want to look at making sure that you don't gain weight as you get older. It's especially true for African Americans. Their BMI, if it's over 35, if you saw before in the general population, if it was increased, it was a 69% was your greatest amount. For the African American population with a BMI of over 35, we're looking at a possible increase rate of 122% recurrence. So weight management is very key in this population. They're not certain if it's related to chronic inflammation or increased level of insulin resistance or increased levels of insulin-like growth-like factors. Could all be contributing factors. So what we generally recommend is regular exercise with a low-fat diet. This will decrease those insulin growth-like factor. What that does is it causes all cells to grow. So if your body has to release more and more insulin because you're more insulin resistant, then more of the insulin-like growth-like factor is released, causing all the cells to grow. So that's why we want to keep that level down. And what we recommend is anywhere from 30 minutes of exercise a day. We want a combination of aerobic and resistance training. And as a person gets older, that muscular structure will decrease, so we need to keep it up. And we generally recommend at least 3 hours of vigorous activity for anyone over the age of 65, and that will decrease the risk of recurrence by 70%. Discussed a low-fat diet. Fats is one of the major components or risk factors, a high-fat diet for prostate cancer. The recent study showed low fat or no animal fat decrease that PSA level. So we really want to focus on saturated fats, which are going to come from meats and dairy products. A diet high in those will increase the prostate cancer risk, especially trans fats. Men with the highest level of serum with the trans fats have a 116% increase in their tumors. Fortunately, the government just mandated that all trans fats be removed from the food supply. So that is a very good thing. But we do want to watch that high fat. Even if you're not getting in the trans fats, a high fat diet will actually increase testosterone, which will then promote tumor growth as such. But we do need a certain amount of fat for your body to function properly. So what we want to look at is your essential fatty acids, which are going to be your omega-3s, omega-6s, and omega-9s. A high intake of omega-6s, which are going to be more along the lines of what you would find in processed foods, are going to lead to increased tumor growth. It stimulates the genes, and it also stimulates inflammation, that chronic low-lying inflammation. What we want is a higher intake of the omega-3 fats, which you're going to find in fish, walnuts, flaxseed. Right now they say the general diet, the American diet has a ratio of 1 to 14 of omega-3s to omega-6s. Ideally, we would like a 1 to 1 or a 1 to 4, so we dramatically need to reduce the omega-6 intake. And we can do that by decreasing the saturated fats and the trans fats. Want you to avoid what we call alpha-linolenic acid supplements. They're a component of omega-3s. However, the synthetic version of them actually increases the risk of prostate cancers. The food sources do not. So I want you to stay away from those and then increase the intake of the omega-3 fats, which are like, again, we discussed the fish. Really would love to see you get in 3 servings a week if you can. Would love for it to be wild-caught fish versus farm-raised, and the reason being is that it will have a higher omega-3 rate. The farm-raised tend to, they give them feed now, so their fat composition will be different and it'll actually be higher in omega-6s than the omega-3s, so go with the wild-caught. Discussed meats. Increased intake in meats will increase the risk of prostate cancer, and it's that dietary fat. Studies show that the intake of what we call the mutagens of heterocyclic amines, and the main component is the PHIP, and this develops when you cook meat at a high temperature. I know it's grilling season and people are out there wanting to grill, but that high temperature actually changes the composition of the meat and will produce what we call these heterocyclic amines. They found meat cooked at high temperatures, 1 meal will actually increase the PSA level. So we really want to go with either, if you're going to have a lot of meat or eat more of the meat, we really want you to go with more of a plant-based diet. But if you're going to have the meat, want it to be cooked at a lower temperature for a longer time, or if you do want to grill, pre-cook it. Make sure about 3/4 of the way finished, and then finish it off on the grill if you want, but marinate the meat. That will protect it and prevent those heterocyclic amines from forming. Recently they found that dairy products also increase the risk of prostate cancer and recurrence. They weren't certain at first if it was the dairy calcium or the fat composition, and now they have found that it is both, and possibly the hormones that could be in the milk as well. And because milk contains natural sugars, it will increase those insulin-like growth factors. So all of those components will increase the risk. They found that an intake of 3 servings or more will actually increase the risk 141%. So we really want you to decrease that intake. If you do need to use it, just a very moderate amount and use the low fat or non-fat. But they did find that non-dairy sources of calcium do not promote that tumor growth. Now, intake of soy, which is a plant-based protein, actually has an inverse association with prostate cancer. Part of that could be in relation that soy is a phytoestrogen, and it will help to kind of normalize the hormones in the blood. The PSA level will drop as the intake of soy increases. All soy protein will inhibit cancer cell growth as well. I would suggest going with organic soy if you do have it, as that we can make sure that there's no genetically modified organisms in there as they're further studying those. And then we also want you to have a soy protein that is the least processed. So things like tofu, tempeh, edamame, those types of items would be good. The highly processed, the veggie burgers where it's very processed soy, or like Cliff Bars. We really want you to keep your intake of that to a minimum, going more with the whole soy. Also want to increase fiber. It's been shown to bind to any circulating hormones. So we really want you to have a combination of soluble fiber and insoluble fiber. So it can bind to the hormone, excretes it. It will also help with weight management, as it helps you to keep full longer. And it will also decrease your insulin-like growth factors, as it will slowly allow the carbohydrates to be entered into the bloodstream. So we really recommend going with 20 to 30 grams of fiber per day. And flaxseed meal is also a good source of that. What I generally give as a rule of thumb is a high fiber food would be considered anything that has 5 grams of fiber per serving. So that would be a good way to look on the food label. So they have these English muffins. Thomas's has good English muffins that are heart healthy, and they have over 5 grams of fiber per English muffin. And that would be, right there on the label, it'll show you the dietary fiber on the nutrition label. So we really recommend going with more of a plant-based diet. It will actually decrease the development and progression. And we found that that's why with the intake of meats and dairies, we really want to go more heavier on plant-based. Plant-based diet is defined as your plate would be 3/4 at least coming from plant sources, maybe 1/4 from animal sources, but if it can be all your diet, that would be fantastic. Specifically for prostate cancer, we look at cruciferous vegetables and tomatoes, but all of the vegetables, all bright colors, have phytonutrients that help to fight cancers. Lycopene is the big gun that comes through when we hear about prostate cancer. It's found in any of the red-colored foods and fruits and vegetables, and you actually extract more lycopene from a tomato if you cook it than if you ate it raw. So we really want you to get a mix of raw and cooked fruits and vegetables. It will definitely lower the PSAs and decrease the risk of the prostate cancers. Also, fruits and vegetables, because of the fiber intake content, will decrease the insulin-like growth factor that will be a contributing factor. And then they found that if you have the lycopene with a touch of fat, you actually will absorb more of the lycopene than if you had it without fat. It's insulin-like growth factor, which is associated when your insulin is released, and that is also released into the body, and it causes all cells to grow. So if you have a high release of a lot of insulin, or if you're insulin resistant, then you have more levels of that, higher levels of it, or if you also eat a lot of added sugars. If you eat a lot of desserts and white breads and fiber deficient foods, it tends to be higher levels of that released. Cruciferous vegetables, and these are the anti-cancer properties that are associated with cruciferous vegetables. So things like broccoli, kale, cauliflower, all of those are great sources. And what they have found, you eat cruciferous vegetables, they have a certain amount of prevention. So they would decrease about 34%. If you have the lycopene, the cruciferous 12% decrease, 34% decrease in a recent study if you have the lycopene. But if you combine the two, if you put together cruciferous and tomato products together, synergistically, they can decrease up to 52% decrease. So that decrease in tumor formation and prostate cancer. So we love to see you get the actual food products and eat the actual food items rather than go with supplements because of the synergistic effect that they will have. So we recommend 8 to 10 servings of fruits and vegetables a day. If we're looking at weight management, we want to go more with the vegetables that are lower in calories. Go with, say, 3 servings of fruits per day, and pomegranates, actually, they fall in that red, so they're very beneficial. And if you can get in some tomato juice, go with the low sodium tomato juice. 12 ounces per day was also helpful in prevention. And like I said, we always want to go with food sources over any types of supplements or vitamins because they will give you more of that synergistic effect. Green tea is also beneficial. It has a cancer-fighting component called EGCG. It will work synergistically too with the soy and the lycopene to enhance and prevent more of the prostate cancers. And we really want the greater increase in consumption is the greater decrease in risk. So there are some vitamins that we do recommend. Vitamin D is known for cancer prevention. It will offer some cancer prevention. We'd like for you to get your vitamin D levels checked. You want to be in a normal range of around 20 to 50 nanograms per milliliter. What we have found is that the lower level of the vitamin D, serum vitamin D, actually puts at higher risk for all cancers, but especially prostate cancer. You get most of it from the sun, your absorption through your skin. So as we get older, that ability to absorb the vitamin D and produce the vitamin D from the sun through our skin decreases. It also is, if you're overweight, it also prevents that absorption and that production. And one of the other reasons for African Americans, the darker your skin complexion, the less vitamin D is produced. So this is one that you would definitely want to get checked. If the level is low, then we would consider a vitamin D supplement. In Michigan, between October and May, you could be outside for all day long, and you're still not going to absorb enough vitamin D because we're above a certain latitude that prevents us from getting the maximum absorption. So I would definitely, between October and May, go with a supplement. There are some other vitamins that have been considered helpful as far as preventing prostate cancer. Vitamin D is one of them. However, it's only the natural form. So we do not recommend that you take a supplement of vitamin E. The synthetic form actually increases the risk of prostate cancer because it suppresses the natural vitamin E. So we do not recommend going with a supplement here, but food sources would be fine. So if you have seeds, nuts, going with a little bit of like olive oil, those types of things, that would be the way to go. Selenium was another one that they found is only beneficial in preventing prostate cancer if the patient is deficient in selenium. So food sources would be another way to make sure. So things like whole grains, spinach, Brazil nuts, different things like that would be great sources of selenium. So in general, we recommend getting regular exercise, 30 to 60 minutes per day, decrease the intake of trans fats, avoid those alpha-linolenic acid supplements, increase the fish or fish oils, get a moderate consumption of whole soy foods, try adding freshly ground flaxseed to your diet, minimize dairy products, and then get a variety of fruits, vegetables, get lots of color, and add green tea to the diet, 1 to 3 cups per day. Weight management would be the key thing, so regular exercise. They have found that overweight, actually the percentage of recurrence is much higher if a man is overweight or obese.
So patients who have had radical prostate surgery or radiation therapy for prostate cancer, yes, they're cured as long as their disease never comes back. But it does come back And many of those patients, even when it comes back, may never ever get sick from it, may live for years and years without any illness. And all the things that Deb is talking about here about diet do play a role in reducing the risk of dying of the disease should it come back. So these are very important things to follow for those of men who have not yet had prostate cancer and don't ever want to get prostate cancer, but they're also important for men who have any recurrent disease following definitive local therapy. So I think the question is, can dietary changes and modifications of lifestyle, and do we have control in any of these ways of altering what we're doing with our lives to actually reverse or abort the process of cancer progressing? Right. So I think it's a great question, and obviously we all, when faced with a health problem, we want to know from our doctors, besides just what you're going to do for me, what can I do for myself, and how can I help myself, and can my lifestyle changes and my dietary choices make a difference? And I think the data that's been presented tonight is clear that it does, and you saw a number of slides here that Deb presented, very good data that shows obesity, intake of certain, obesity is a bad thing for prostate cancer cells. The intake of the fiber and the soy and the types of fats that are in the foods, the different fish oils. I think these things clearly have been shown in studies to make a difference. Now, I don't think any of the studies, though, have ever shown that you can actually cure or reverse and make it disappear. It just changes the incidence of aggressiveness. So that just means that a person, men with prostate cancer, they live for years with metastatic disease typically. It isn't a disease like other cancers, realistically, for instance, lung cancer. People with lung cancer don't live for 10 or 15 years. People with prostate cancer frequently do. So there's reasons for a prostate cancer patient to be as proactive as possible. And we advocate all of the changes that we talked about here for the purposes of prolonging life and prolonging the period of time where the disease may be within yourself based on a PSA blood test, but you feel well. You're pursuing your lifestyle. You're doing all the things you want to do in life, and isn't that what matters? The question is, are there genetic factors that create risk that integrates with other risk factors? And I think that, of course, genetics is probably the paramount issue with risk for breast cancer, prostate cancer, colon cancer, pancreatic cancer. Other cancers seem to be very dependent upon lifestyle. So alcoholism can lead to esophageal cancer and gastric cancers and oral cancers, and smoking can certainly lead to cancers of the respiratory tract and the oral part of our mouths. So it depends what cancer you're talking about in terms of the balance. I think with prostate cancer, genetics plays a large role, because there are men who get prostate cancer when they're in their 40s and 50s, and almost certainly there's a genetic component to how and why at such an early age their cells transformed, and it may not be because they ate the wrong foods or did anything wrong. They just had this. But we can't change our genetics. At least we can't in 2015 change our genetics. That would probably be the goal of another decade or two down the road, that we would have some way of splicing out and getting rid of the bad genes and putting in some good new genes. I don't know. But for right now, we're dependent on our mother and our father and our grandmother and our grandfathers, and what you're saying is true. And what you can glean from that are risk factors. And I do believe that we're very rapidly moving in the direction of understanding the genetics of cancer. And it won't be very much longer before people will have an identification of their risk, so that an individual is recognized at being at increased risk of perhaps prostate cancer or colon cancer, and would undergo the appropriate interventions to minimize that risk. So all of these dietary things that we're talking about tonight and the research that Deb has presented are going to become especially important to integrate into that genetic understanding of disease.
I would recommend staying away from the nutrient deficient foods.
Yeah, I'm sure that sugar isn't good for anything much, but processed foods replace the healthy calories, and a diet that is high in the vegetables and foods that were discussed here as being healthy for you is certainly going to be substituting for calories that are taken in carbohydrates. And basically, sugar is not just sugar. Sugar is carbohydrates, which are pretty much all, white bread and rice and the grains that get instantly metabolized in our body into glucose. Right? They turn into glucose very quickly in the digestive system. It's just like you might just as well be taking teaspoons of sugar as eating a piece of white bread or a bowl of rice.
The question is if we should, organic soy milk should replace regular dairy milk or cow's milk, and I would say that that would be a very good substitute. Absolutely. And the question was if they should go with any poultry over red meat, and really want you to reduce the amount of all animal protein. The amount of fat in red meat is about 28% if you have lean red meat. If you go with white chicken breast, it only goes down to about 26%. So you don't gain a whole lot by decreasing going to that. So we just want all of the amount to be reduced and going heavier, filling up that plate more with the fruits and the vegetables. Fish, three times a week would be fine. Like 3 servings of the high-fat fish would be fine. So we would actually go with more things like beans, legumes, dried beans, legumes, those types of foods to give you the protein without the fat, and will also give you the fiber. The question was supplements, if I could give an overview as to why they are not as good as going with the actual food product or the food item. And the reason being is that when you extract only a single nutrient from a food, you lose that synergistic effect. So one of the other examples that I could give you would be broccoli, which has what we call brassica. They extracted brassica from it, put it into tea, had this whole product, and they didn't get the same results as they did with broccoli because of all of the other components that actually activate it. So that's one of the reasons that supplements are not as efficient and not as good. And then also when I had mentioned the vitamin E, the synthetic form actually suppresses the natural form of vitamin E in the diet and will promote prostate cancer. So we do not recommend going with the vitamin E supplements.
Yeah, Karen, that's a great question, and it's especially important in the era that we have now of active surveillance of men with low-grade, small-volume prostate cancers. Many of the patients that got prostatectomy and radiation therapy 10 and 20 years ago, because everyone used to get treated, now are on surveillance. So all of the issues that we're talking about here are actually being used in our practice. And what you said, I think, is true. We sometimes repeat biopsies, and we routinely on active surveillance resample the prostate. And I don't tell patients that their cancer is gone, but we do see improvement in biopsy results. We may see a Gleason score actually go down or stabilize on appropriate management of our active surveillance population of patients. It's important in patients who have a risk factor because their father or their grandfather and they have a family history of prostate cancer, or a man who at age 50 has a PSA level of above 1.0, or a man at age 60 who has a PSA of above 2.0. Those are risk factors. So we look at different men in different population groups. I pay more attention to those things than I do about baldness, for example, which is a small risk factor. Deb mentioned vasectomy. Now, I didn't say anything at the time, but I take issue with that being in your presentation. That actually was looked at in several studies, large studies of thousands and thousands of men who had had vasectomy. And, statistics are kind of hard to work with, and there was at first, there was a thinking that it did cause an increased risk in prostate cancer, but then it was more detailed, looked at with the statistical analysis of those papers, and it was thrown out. And so now, when a patient asks a urologist or a physician, is my having a vasectomy going to increase my risk down the road of having prostate cancer? The scientific definitive answer of that question is it does not. It has risk factors associated with your diet, for sure, and with exercise, for sure. But vasectomy is not considered a risk factor, a positive risk factor. It does not increase your risk of having prostate cancer.
So the question was, how could it reoccur if the prostate has been removed?
The prostate gland is attached to the bladder above it, to the urethra below it, and to the rectum and the seminal vesicles behind it. On all three of those areas, there could be areas of prostate cancer cells that escape the prostate when the prostate gland is removed. So cancer cells escape the primary organ. That's why it is lethal. And that is what our goal is at the time of a prostatectomy, is to cut it out while every cell is contained within the capsule of the prostate and the seminal vesicles behind it, which are removed when we do a radical prostatectomy. But that doesn't always happen. The recurrence happens when a cell, and it may just be a few cells or something microscopically invisible at the time of the surgery, are already out. And so you've removed the prostate gland, but there are still some cells that escaped, and that's where the recurrence occurs, and it can take years for it to be detectable.